students. In the previous class we had studied about neuralgia, Bell's palsy and peripheral neuropathy. Hope you would have seen the videos and would have taken down the notes. So now we'll start with next topic, that is spinal cord tumor. आप लोगों ने पिछले क्लास में जो भी मैंने पढ़ाया था, जैसे कि न्यूरालगिया, बेल्स पैल्सी, पेरिफेरल न्यूरोपैथी, इसके बारे में पढ़ा हो, देखा, वीडियोस को देखा होगा और नोट्स भी बना लिया होगा. तो हम लोग आज का क्लास कंटिन्यू करते हैं. So today we'll start with next topic, that is spinal cord tumor. So what is this spinal cord tumor? Spinal cord tumor is nothing but cancerous growth in the spinal cord which might be benign or malignant. Okay, which might be benign or malignant. So that is cancer. It is usually spinal cord tumor. It is usually a cancerous growth in the spinal cord which might be benign or malignant. स्पाइनल कॉर्ड ट्यूमर वो होता है जो एक कैंसरियस ग्रोथ होता है स्पाइनल कॉर्ड में. ये बिनाइन हो सकता है, मैलिग्नेंट हो सकता है, मतलब ये स्प्रेड हो सकता है, ये स्प्रेड नहीं भी हो सकता है. सो इट इज़ यूजुअली स्पाइनल कॉर्ड ट्यूमर. एंड दिस स्पाइनल कॉर्ड ट्यूमर्स और दिस ट्यूमर्स, इफ इट यूजुअली compresses the spinal cord or nerve roots. Okay, if it compresses the spinal cord or nerve roots, then immediate medical attention should be taken. The patient should be hospitalized and proper treatment should be started, because this compression on the nerve roots can lead to paralysis. Okay, can lead to paralysis. So that is usually about this spinal cord tumor. So spinal cord tumor, it is nothing but cancerous growth in the spinal cord which might be benign or malignant. And this if the tumor provides or compresses the spinal cord or nerve roots, okay, if it compresses the spinal cord or nerve roots, then immediately medical attention has to be taken and the patient should be hospitalized and proper treatment should be taken, because this might lead to paralysis. Okay, this compression to nerves can lead to paralysis. So that is usually, if the tumor is benign also this can happen. Okay, if the tumor is benign also this can happen. तो स्पाइनल कॉर्ड ट्यूमर वो होता है जहाँ पे स्पाइनल कॉर्ड मतलब कैंसरियस ग्रोथ होता है स्पाइनल कॉर्ड में. ये बिनाइन होता है या मैलिग्नेंट होता है. अगर ये ट्यूमर दबा रहा है नर्व रूट को या स्पाइनल कॉर्ड को दबा रहा है, तो इमीडिएटली द पर्सन उस बंदे को हॉस्पिटलाइज करना है और प्रॉपर ट्रीटमेंट लेना है, क्योंकि ये जो नर्व्स को अगर ये दबाता है, ट्यूमर अगर नर्व्स को ज़्यादा से ज़्यादा दबाने लगता है तो ये पैरालाइज करता है. इसलिए इमीडिएटली हॉस्पिटलाइज करना है. अगर वो ट्यूमर बिनाइन होने पर भी बंदे को हॉस्पिटलाइज करना है कंप्रेशन होने की वजह से, और उसको ट्रीटमेंट लेना है. सो दैट इज यूजुअली अबाउट दिस स्पाइनल कॉर्ड tumor. So next is types. So types, it might be primary and secondary. So primary tumor, it is mainly which usually the tumor occurs in the spinal cord itself, and secondary if they if there is spread of like tumor usually spreads from other parts of the body to the spine. Okay, if the tumor spreads from other parts of the body to the spine, then it is usually called as secondary tumor. So primary tumor usually starts from the spinal tissue, that is usually called as primary tumor. And secondary tumor, if the tumor develops from other parts of the body or spreads from other parts of the body to the spine, that is usually called as secondary ट्यूमर. तो ट्यूमर यहाँ पे दो प्रकार के होता है, एक तो प्राइमरी ट्यूमर हो गया, सेकेंडरी ट्यूमर हो गया. प्राइमरी ट्यूमर वो होता है जहाँ पे ट्यूमर स्पाइन टिश्यूज़ में शुरू होता है, और सेकेंडरी ट्यूमर होता है जो बाकी के दूसरे पार्ट्स में जो ट्यूमर होता है वहाँ से स्प्रेड होकर स्पाइन को इफेक्ट होता है, वो होता है सेकेंडरी ट्यूमर. तो प्राइमरी ट्यूमर वो होता है जहाँ पे खुद मतलब यूजुअली वो स्पाइन टिश्यू में ही होता है, और सेकेंडरी ट्यूमर जो बाकी के दूसरे पार्ट से स्प्रेड होकर स्पाइन में होता है, तो उसको हम बोलते हैं सेकेंडरी ट्यूमर. सो प्राइमरी ट्यूमर which usually starts in the spine tissue, secondary tumor where the tumor usually spreads from the other parts of the body to the spine, that is usually called as secondary tumor. So next, there are the different types of tumor that is usually present. That is, first is intramedullary tumor. Okay, that is intramedullary tumor. There are other types of tumor, that is intramedullary tumor. Okay, that is intramedullary tumor. So in this usually means that the tumor are located within the nerves of the spinal cord. Okay, tumor are located within the nerves of the spinal cord. Intramedullary tumors are the tumors which are located inside the nerves of the spinal cord. तो बाकी के मतलब बाकी के ट्यूमर्स होते हैं, जैसे कि इंट्रामेडुलरी ट्यूमर, जो ट्यूमर होता है वो नर्व्स के स्पाइनल नर्व्स में होता है. यूजुअली स्पाइनल कॉर्ड के नर्व्स में ही होता है, स्पाइनल कॉर्ड के नर्व्स के अंदर ही होता है. सो दैट इज इंट्रामेडुलरी ट्यूमर. So they are usually along, other than that primary and secondary tumor, there are other tumors like intramedullary tumor. Intramedullary tumors are the tumors which is usually present within the nerves of the spinal cord. Okay, which is present within the nerves of the spinal cord. जो nerves के अंदर होता है, spinal cord के nerves के अंदर होता है, उसको हम बोलते हैं intramedullary tumor. So next is intradural extramedullary tumors. Okay, intradural extramedullary tumor. So in this usually the tumor starts at the covering of the spinal cord. Okay, it starts with the covering of the spinal cord, that is outside the cord itself. Okay, that is outside the cord itself. So in this tumor starts from the outer covering of the spinal cord, that is from outside the cord itself. Okay, outside the cord itself. So that is usually what happens. It usually starts inside the covering of the spinal cord. Okay, it usually starts inside the covering of the spinal cord, but it will be outside the cord. Okay, but it will be outside the cord. So that is intradural extramedullary tumor. Okay, intradural extramedullary tumor. So first is intramedullary tumor, where the tumor starts within the nerves of the spinal cord. Intradural extramedullary tumors are usually the tumor which usually will be occurring within the covering of usually occurs inside the covering of the spinal cord as well as the outside the cord itself. Okay, outside the cord itself. This is intradural extramedullary tumor. So next is extradural spinal tumor. Okay, extradural spinal tumors usually starts at the bones of the spine. Okay, the tumor usually starts from the bones of the spine. So extradural spinal tumor is the tumor usually starts from the bones of the spine. Okay, this from the bones of the spine. So that is extradural spinal tumor. And the last is secondary spinal tumor. So that is, I also told that it is usually spread from the other parts of the body to the spine. Okay, it usually spreads from the other parts of the body to the spine. So that is secondary bone tumor. So classification of this tumor, it includes like it is first is primary tumor and secondary tumor. Primary tumor, it is usually where primary tumor where the tumor starts within the spine tissues, that is usually primary tumor. Secondary tumor where it usually spreads from the other parts of the body to the spine, it is secondary tumor. And the other tumor types, classification, it includes intramedullary tumor, which is usually tumor occurs within the nerves of the spinal cord. Intradural extramedullary tumor, it is usually occurs within the covering of the spinal cord but outside the cord itself. And extradural spinal tumor, here it usually occurs within the bones of the spine, that is usually tumor occurs within the bones of the spine. And secondary spine tumor, it is usually where it spreads from the other parts of the body to the spine. So that is usually about this types of ट्यूमर. तो टाइप्स ऑफ ट्यूमर बहुत प्रकार होते हैं. जैसे प्राइमरी होता है जहाँ पे स्पाइन टिश्यू में ही होता है, और सेकेंडरी होता है जो दूसरे पार्ट से लेकर स्पाइन को इफेक्ट होता है. उसके बाद होता है इंट्रा मेडुलरी ट्यूमर जहाँ पे नर्व्स स्पाइनल कॉर्ड के नर्व्स के अंदर ही होता है ट्यूमर. इंट्राड्यूरल एक्स्ट्रा मेडुलरी ट्यूमर यहाँ पे जहाँ पे वो कवरिंग होता है ना स्पाइन का उसके अंदर होता है मगर कॉर्ड के बाहर ही होता है, अगर कॉर्ड के बाहर ही होता है. और तीसरा हो गया एक्स्ट्राड्यूरल स्पाइनल ट्यूमर जहाँ पे बोन्स स्पाइन का बोन्स में इफेक्ट होता है. ट्यूमर कहाँ पे इफेक्ट होता है? स्पाइन के बोन्स में इफेक्ट होता है. और चौथा हो गया सेकेंडरी बोन ट्यूमर जहाँ पे दूसरे पार्ट्स से लेकर वो स्पाइन के बोन्स को इफेक्ट करता है. सो दिस आर यूजुअली द डिफरेंट टाइप्स ऑफ ट्यूमर. सो दैट इज यूजुअली अबाउट द स्पाइनल कॉर्ड classification of spinal cord tumor. And next is causes. So causes mainly it is unknown or it might be due to genetic factor. Okay, causes are mainly unknown or it might be due to genetic factor. So the causes are mainly unknown. Okay, the causes is unknown, so that is usually it was not known. And the other reason it might be due to genetic factor. तो causes यहाँ पे पता नहीं है अभी तक कि क्या exactly क्या cause है, मगर यहाँ पे देखा जाता है कि ये genetic factors की वजह से हो सकता है. So mainly causes unknown, but it has been found that it might be due to genetic factor. Okay, it might be due to genetic factor. So that is usually about this causes. So next is symptoms. So symptoms, when we talk about the symptoms, mainly they will be pain. Okay, they will be having pain in the back and neck. Okay, they will be having severe pain in the back and the neck. Okay, so that is they will be having severe pain in the back and neck. And also they will be having numbness, tingling sensation. Okay, they will be having numbness, tingling sensation, or they will be having paralysis. Okay, or they will be having paralysis either in the arm or legs. Okay, either in the arms or legs. So that is pain in the back and neck region. Numbness and tingling sensation will be there, or paralysis will occur which might be affecting both legs or arms. Okay, which might be occurring both legs or arm. Bowel and bladder disturbances can occur. Okay, bowel and bladder disturbances can occur. Erectile dysfunction can occur. Okay, erectile dysfunction can occur. And also muscle contraction. Okay, usually muscle contraction will be there. Muscle contraction or muscle spasm will occur. Okay, muscle contraction or muscle spasm will be occurring. And also they will be having difficulty to walk. Okay, these are usually the symptoms that is usually seen in case of this spinal cord tumor. That is severe back pain and neck pain will be there. and also they'll be having numbness and tingling sensation. Paralysis can occur, which might affect both the arms or both the legs. Loss of bowel and bladder control will be there. Muscle spasm will be increased. Erectile dysfunction will be there, which is seen in the males. Okay, erectile dysfunction will be seen in the males, as well as they'll be having difficulty to walk. Okay, as well as they'll be having difficulty to walk. तो symptoms जो हम लोग यहाँ पे देखा जाता है ना, नेक में बहुत ज़्यादा, गर्दन में बहुत ज़्यादा दर्द होगा और पीठ में भी बहुत ज़्यादा दर्द होगा उनको, और उनका बबल एंड ब्लैडर मूवमेंट्स में भी प्रॉब्लम, दिक्कतें होगी, उनको चलने में प्रॉब्लम होगा, और लड़कों में या मेल्स में मतलब उनका इरेक्टाइल डिस्फंक्शन होगा, सीधे से वो इरेक्ट नहीं कर पाएंगे, और उसके बाद उनको मसल स्पैसम ज़्यादा होगा, नमनेस और टिंगलिंग सेंसेशन ज़्यादा होगा, उनको पैरालिसिस होगा, ये आइदर पैरों में होगा या हाथों में होगा, मगर ये पैरालिसिस होगा ये. दिस आर यूजुअली द सिम्टम्स ऑफ दिस स्पाइनल कॉर्ड ट्यूमर, दैट इज पेन in the back and neck, numbness and tingling sensation, paralysis of the both arms or legs, loss of bowel and bladder controls, like erectile dysfunction in males, muscle spasm will be there, as well as they'll be having difficulty to walk. So the remaining we'll see in the next video.